Thank you for tuning in. You just got to watch a wonderful video outlining the historical Bordentown, New Jersey. And here with me right now is Dr. Margaret Kilibwa. Thank you very much.
Nice to be here, Dina.
Thank you. And it is due to her efforts that we are here today. This is a night of celebration. We're celebrating this wonderful, wonderful organization that Dr. Kilibwa has created, Tropical Clinics. And we're here so that you can help her help the people of Kenya. Dr. Kilibwa, you have such a wonderful story. And I was telling them, I've just been giving people, filling them in just a little bit about who you are and what brought you to help the people from your country. But can you just give us a little feedback on your story? Tell us about your story.
Yeah, my story is really going back to Kenya and going to the area where I was born and seeing so many people suffering, so much poverty, and a lot of children really being malnourished and not having any support. Women walking 10, 20 miles to find the closest medical center and just wondering, what can one do? And when a lot of people seeing this, they will say, well, we'll let the government take care of them because that's the government's responsibility. They will say, well, we'll let the local government build them a medical center. And you go to the medical center, the one that the local government has built, and people walk 10, 20 miles, dinner, and they come in after walking that long, they have no medicine. And they have to walk back 10, 20 miles without any medication, without any treatment. So I saw this and I said, there is something that can be done. You know, sometimes when you have a calling, when you see something like this, you really are compelled to act. And I did. So I founded Tropical Clinics as a way to really build a medical center that we could stock with medicine, medical supplies, and preventive care for these women and children. And we knew when they came to our treatment center, they will go back having been treated, having had the best quality of care they could get. And not having to go back empty, even though they would have walked miles and miles to come to our clinic.
Now, what specifically inspired you when you first went home and you saw that there was this need? You saw that there was a place where you could step in and help.
Yes.
To fill this need.
Yeah.
What was the first thing that impacted you when you went home that said, I have to do something to help my people?
What inspired me, actually brings tears to my eyes when I think about it, was to see a woman being taken to hospital on a bicycle and she's bleeding. And by the time, you just know by the time she gets to the hospital, either the baby is dead or her life is in jeopardy. That just inspired me. And I actually stopped one person on a bicycle and asked them, how far did you come to come and get medical care for this woman who seems like she's in dire need of care? And he said he had been bicycling 20 miles away to come and get care. And that it just hit home, and I said, I got to do something about this. And that was the first inspiration. The second inspiration was when we first set up a medical clinic to really help. It was a triage type of clinic to help a lot of people around. And this old woman walks 5 miles because she has had that when she comes to a medical camp, she will get her tooth removed that has been paining her for about 7 years. That could actually just be $5 to get a tooth out. She couldn't afford that. When she came, we gave her medical care. We removed the tooth. My team removed her tooth, and the smile I saw on her face just made me feel like we have to do something about this. We have to set up a medical center and help people like this woman who has come in for a tooth removed, or the one being cycled on a bicycle, to go to a medical center where she may not even get care.
Yeah.
And I was really inspired to put up a treatment center to make sure that we can help these women to get care that they need. And we could actually do it at affordable price or than they could if they went to a medical center where they couldn't even get good care.
Now, when you say care, I know you mentioned the triage center that you were creating that. When you say care, what type of services will Tropical Clinics, or does Tropical Clinics provide?
Yes, we are focusing on reproductive care, so a lot of prenatal care,
Okay.
obstetric care, gynecological care, and we also do a lot of screening for women on cervical cancer, on diabetes, hypertension. We are also focusing on children's care. So make sure that the children have enough nutrients so that we can help prevent malnutrition. We are also treating the HIV patient. Right now, if you go to Africa, to a lot of African clinics, the people who are infected with the HIV and AIDS, they come in and they will get some of the AIDS HIV medication, but then they're sent home. What we are doing at Tropical Clinics, we are taking care of that whole patient. We find out how their home care is. We give them some psychological counseling, and we also give them some nutrition. So we make sure that their nutrition is also taken care of. So we are taking care of the whole person instead of just giving them HIV medication. And then we are just champions of making sure that women are getting good care. And if what I've seen, especially in the rural Africa, especially in rural Kenya, if we are able to bring care to women, we know that we'll be bringing a whole care to the community.
And when you say that, can you explain by when you're bringing care to one woman, you're bringing care to the entire community? Can you explain
For example, I'll give an example of one woman I met who had no energy at all because she was anemic. We treated her and brought her iron level up, and her anemia actually went into remission.
Okay.
What happened with her, which was very exciting, was because she now had enough energy and she was feeling good, she started a women's group to grow vegetables in the village, so that now they could sell the vegetables and be able to go to get affordable care. They can pay for the medication now because now they have things to sell, and they also have vegetables for themselves. So we were able to help one woman to help 10 women who she knew. And that is just an example of if you bring care, you are now bringing well-being to a lot of women in the area. You are creating a very healthy community because now they can be able to support each other.
Now, I know Kenya has a very rich history. What does community mean to the people of Kenya? Because that's, because by doing that, I know that the person that was able to provide that service for her
group of
people
women
that she lives around, I'm sure that brought something back to her as well. But what does community mean to the people of Kenya?
Community in Kenya, the one I know better than probably it's common to other African countries, but I know it better in rural Kenya especially. Community is people bonding together and making sure that they have their children go to school, making sure that their children are eating well, making sure that they have community projects either for women or for men, making sure that they can take care of themselves. They really have this desire. But when you find a lot of them being sick and not being able to take care of themselves, they lose that. They lose that community value. And then, again, they become beggars because now you have to give them handouts to survive. So our approach is to really bring a model care where you are creating a community that is healthy and then it can begin to support itself.
Now, I know the container that you were able, with the help of Johnson & Johnson, able to raise all of these different medical supplies to fill this tremendous container up and get it over there.
Yes.
What is the need? Can you just talk a little more about some of the things, some of the basic supplies that we here in the States might take for granted that are desperately needed?
That's a very good question, Dina. For example, we have stethoscopes, microscopes, just masks for the nose and for the eyes and whatnot, earplugs, microscope, just for diagnosis. We have all these things in the container and it's sitting there at the port. If it were in our clinic, for the first time, somebody would come in area is diagnosed, which they're not able to do now. You go there and you go to a triage clinic and the physicians are fabulous. They're very hardworking. They don't have this equipment. So what they do is they go by feel. They can look at somebody and they say, oh, that we think he has or she has malaria. But now for the first time, if we can get this equipment from the port to our clinic, they will, for the first time, they will have accurate diagnosis. And guess what that will do? Then they can do accurate prescription. And from there, now we are getting back to creating that health community. So we really need to get this container from the port to our clinic so that we can give the tools to our physicians.
Okay. Now, how long have you, now this is, I think you started, from what I read, if I remember correctly, that you started Tropical Clinics in 2005. 2005. What are some of the things that you've been able to do since the time that you started the program to now? How has it grown? How are you seeing it grow?
I have seen tremendous growth, and again, a lot of people behind this growth. We started. I'm very ambitious about this, and when I started, I thought that I would just go out, get a lot of people excited about building a medical center in Kenya. We would get it going, and we will build $1 million facility for the people in rural Kenya. And I tell this story, and people laugh at me, but I really did this. I went to the Clinton's office in Harlem, and I actually told, he had just gotten out of the office. Of course, he's been out of the office for a while at that time. He has the Clinton Foundation. So I went to his office in Harlem, and I actually got an audience with one of his assistants. And I told his assistant, we have a land in Kakamega in rural Kenya. We need $1 million, and we need to build this clinic now because I just know how much more it would help a lot of people. And I got a laugh out of that from the assistant because he said, no, it takes a lot more than that to actually build a medical center. And somehow I think they did me a lot of good service, because if we had built a medical center at that time, I would not have had a chance to understand what it takes for a rural area like the one we are in Kakamega to really appreciate who we are and to appreciate the care that we are bringing to them. So since we started, I decided, okay, I can't get $1 million right now to build a medical center. So what I'm going to do, we will go back once a year. We'll set up the triage for 3 to 5 days. We will treat as many people as we can with donations of medicine and medical supplies from Johnson & Johnson, from MAP International, it's an affiliate of Johnson & Johnson, from Bristol Myers. So every year I would have about 5 different suitcases with me. And I call Virgin Atlantic and I say, I am carrying 5 suitcases with me. And I'm bringing them in because we're going to do a triage clinic. And they would say, okay, we'll let you carry 3, but you have to pay for 2. So I did this, and I did this for about 5 years. And what that did was tremendous. I saw now what is ailing the community. A lot of people have malaria, tropical diseases, pneumonia, whooping cough. Some of them, some very simple hygiene issues that are very easily preventable, but they didn't know. And so for that entire time of 5 years, from 2005 to about 2010, we've learned so much of what is ailing the community. We've also created a database of about 4,800 people that we have seen. We are keeping track of the people we have seen. Out of this, we've also put together a team of about 90 physicians, most of them clinicians and advanced nurse practitioners. So thank you, God, for the Clinton Foundation saying, no, I don't think you can raise $1 million just now and go build a medical center. We've learned about the community. We now understand the community very well. And then so last year we commissioned a center. We've renovated it, it's completed. And with the support of the grant from Johnson & Johnson and partnering with Project Cure and Doc to Doc, we've shipped the container. And now we need to get the container to the facility so we can begin offering daily care instead of just once a year.
And who are some of the other supporters? You have Johnson & Johnson, Doc to Doc, who's helped with the container shipment, Project Cure. Tell us a little more about some of the other supporters.
We also have a lot of churches help us. There's a Princeton Alliance Church in Princeton. There's LaGrangeville Church in LaGrangeville, New York. Those are some of my friends who introduced me to them. We also have Mira Gandhi. She's a UN ambassador. She's a very good friend of mine. And in fact, she just made it possible to invite Sherry Blair, who is coming to our center not too long from now. So we really have supporters like this. Sorry, the phone is ringing right in the middle of it, of the interview. So
Okay, it's live. It's okay.
And then we have a lot of volunteers. You will speak to one of them here who take a lot of their time to come and spread the word. And it's great also to have you and to have video imprint to really help us get people to know about Tropical Clinics and get to support us more. So the need is really great, and it's now. And we've gotten a lot of support. We've raised over $50,000 to come to where we are now. So $15,000 will really help us get into a facility that will help us provide our services on a daily basis.
Okay. And Johnson & Johnson helped
with
the
the
majority
grant.
of that.
Majority of the, yes, exactly.
Okay. And tell me a little more. You've spoken a little bit about some of the hospital workers that you have, the clinicians, the doctors and nurses. Can you tell me a little more about the people that are there in Kenya right now, helping out?
Sure. They are trained in Kenya, and it's such a pride for me to when I first started this in 2005. In 2006, we had a scare at one of the airports, and I usually get some physicians from here who come to Kenya with me. And this particular year, they were coming with me, but they were not able to come. I think we had, I forget what the problem was, but they were stuck in the airport and they were not able to make it to Kenya. My first instinct was, we can't do this triage because we don't have physicians. They're not going to be there, so we can't follow through with it. And to my surprise, I get to Kenya and I'm telling the clinicians, the advanced nurse practitioners, we can't continue with the triage because the physicians from the US and from Europe are not coming. I said, who do you think we are? We are trained. We do service here. And to my beautiful and amazing surprise, they did so much work from dawn to dusk, from dusk to dawn, or dawn to dusk. They did so much work and did such accurate diagnosis with little tools that I was so impressed with how much they're able to do. And from that point on, they have been doing the work with us every year. And in fact, 12 of them are now hired to work full-time at our treatment center.
Wow.
And I am so proud of them, and I'm so confident that they're going to offer the best care because now we are giving them the tools to do this. So I am just so confident that the people of rural Kenya are in for a very good care at affordable cost.
Okay. Now, you've shared, you talked a little bit about some of the issues, the health issues that you have seen that are where people are in need, some things that are popping up right now. Can you talk about some of the health issues? I know there's malnutrition, there's AIDS, but there are other things that you're also hoping, the preventable diseases that you're going in to help screen for, to help some of the people. What are
for women, things? That's a very good question also, because one of the goal for Tropical Clinics is to really become a preventive care center. So people can come there and get screened for things that they never even thought that they had, but if they knew about them, they would prevent, or we would help them prevent it. We've found from the 5-year work that we've done, there's a lot of diabetes in the area. There's hypertension, and then there's high blood pressure. And then for women, there's cervical cancer and breast cancer. And I think all of these are diet related. So we are going to help women screen for this and tell them at what stages these are for them. And then we can, of course, offer treatment for them as well in these areas. For men, for some reason, there's a lot of prostate cancer. I don't know why that is. So we're going to be doing a lot of PSA tests for screening for men and also screening for hypertension, because a lot of men in the area die from high blood pressure. So
can you describe what a PSA? Some people don't understand. They don't know what a PSA is.
That is a prostate test that would tell whether somebody has some of the antigens in prostate are higher than they're supposed to be, and if they are, they're most likely to develop prostate cancer. So if they're screened for it, it can be prevented from getting to the level that can result in prostate cancer.
And it's just a simple blood test.
And it's a simple blood test. So men, please, even here in the United States, they should really go for a PSA test, especially if they are of African American origin, because for some reason it may be genetically drawn or derived. A lot of African American men tend to end up having prostate cancer. So we're going to be very vigilant about this, screening the men in the rural Kenya, probably for the first time for most of them.
Yeah.
And help them prevent the development of prostate cancer.
Now, since you've been there for 6 years now with Tropical Clinics, since they've opened, what is the community response? I'm sure they're welcoming, but what kind of response are you getting from the community when you show up?
Yeah, I have a pretty good story to tell. Like at the beginning, at the beginning when I went there, they were like, "Oh my gosh, women don't do this." The men come in and set up clinics and go till the land, and
so it's just a different,
So what is it? It's a very patriotic type of society. So what I did very early on when I found out that I would probably intimidate them by coming in and thinking that I'm taking on a male role and setting up a center and offering the services that we are offering now, was I invited them to be part of Tropical Clinics and explained to them that if they were really the ones driving the community to become healthy. And once I invited them in, and really, especially with the triage clinics, we have elders that come to the clinic just to make sure that they are part of it. Some of them will come in just to talk to the younger people on, okay, if you're promiscuous, you will actually may end up getting HIV.
Yes.
So they come in to just talk to the younger people, and they feel like they're part of Tropical Clinics. And it's something that I've encouraged so that they know that having Tropical Clinics there is for them. It is not Margaret Kilibwa in the USA trying to set up something that she can say she has this, she has that. It's a community project. And so I've invited them in. And for that reason, I get a lot of respect. And I get a lot of thank you from the community, even from the Ministry of Health, locally and nationally. We are now recognized as coming in to provide care that would not exist in rural area. The government is overwhelmed by a majority of the people living in rural areas and not getting good care. So they're really welcoming us and being appreciative of what we are here to provide.
What's the ratio of people who live in the larger cities versus those? Do you know?
Yes, I do. That's a very good question. 20% of the people live in urban areas and 80% in rural areas.
Wow.
So the majority of the people live in rural areas and they don't even have good care. They don't have good medical care, they don't have good hygiene, they don't have access to good food. So really, being in the rural areas, in fact, that's why I chose the area. I knew that it is heavily populated and the impact would be huge. So that's why I chose the rural area for that reason.
Now, your family, you have a lot of family that's still in Kenya.
Yes, I do.
Can you tell us a little bit about your family that you have?
Yes, I do. I come from a large family. Majority of them are in Kenya. I have a brother and sister in the United States, but the rest of them are in Kenya. There's a pharmacist, there's my brother who's in the army, there's another one who's a marine biologist, there's a nurse, and they do their own things, and they're very excited about Tropical Clinics, of course, and so they will lend a hand, and they're very happy when they see me there. Yes.
Now, now, as far as the future, you were hoping to help to combat preventable diseases.
Yes.
You want to inform people about preventive care. What is the future? Where do you see Tropical Clinics in the next 10, 15 years? What do you see them doing?
That's a very good question, because right now we are setting up, we are at this clinic that is an 8-room center. Our main goal is to build a medical center that will have a women's care, total care, so maternity, all the way from maternity to preventive care. We'll have a pediatric center. We have a surgical center. We'll have an office just for physicians. So we'll have a total medical center and maybe a model of care for this particular area. So in 5 to 10 years from now, we expect to really have this medical center built. So I'm really looking to this and have a model there. And if we do, the reason why we call it Tropical Clinics, when we have this as a model, we will send it to other rural areas in
Okay.
Kenya, and then maybe to other countries, neighboring countries.
Mhm.
You know, so that we create, and our motto is the best care you can provide at affordable cost.
The
And
best
so
care
when
at affordable price.
yes, and then when you get people like Johnson and Johnson and Project Cure supporting us, they really help us to be able to provide care, bring care to the community like this one at affordable price.
Okay. Trying to think. Now, my mind went blank for a second. I apologize.
That's okay.
It's not hard to do.
That's okay.
What I know I asked you a similar question, but you had shared something with me that I felt a connection with you when I first met you.
Yes.
The first time that you felt the need to give.
Yeah.
Because I think it's so important because people overlook that. They look at a person like you who has done so much for her community, and they think, I can't. Where do I get started? How do I get started?
Right.
What was the first thing that you did when you really felt that need? Okay.
Yeah, just for a little bit.
Okay.
Sorry, can
No,
we
no.
say something?
Yeah.
Because I need to see the light.
Dr. Kilibwa is going to step away for just a moment, but she is going to come back whenever she can, whenever she has a moment. But we would like to just thank her for joining us today for the interview, and also please donate. Donate. You've heard a lot of the reasons why we're here today, to help out the people of Kakamega, and help build up Tropical Clinics. So I want to thank you so much for sharing with us today.
Thank you so much.
Thank you.
I really appreciate it, Dina, because you're telling our audience and welcoming people into our fold to know about Tropical Clinics.
Yes.
And as they help us save lives.
Yes.
So we really appreciate it.
Thank you.
Thank you.
Thank you.